Hi, I'm Jeannie from health.com, and today we are going to be talking about endometriosis. It's a condition that you may have heard a lot about lately. A lot of celebrities have been pretty open about having it. Lena Dunham, our current cover star Julianne Hough, Padma Lakshmi, a lot of different celebrities have talked about their endometriosis experience. But a lot of people don't know much about it. So today we have New York City OB/GYN, Dr. Rebecca Brightman is here to tell us more about it. And if you have any questions, feel free to type them in the comments and we will try to answer them at the end. So welcome, Dr. Brightman.
Hi, thanks for having me.
So just to get us started, what is endometriosis?
So it's a big word, but endometriosis essentially is a disease where tissue that's similar to that which is normally found inside the uterus actually can occur outside the uterus. And these little spots of tissue, we refer to them as implants or lesions, and they are similar under the microscope to that which is seen in the uterus. They are hormonally receptive, they change because of hormonal exposure. So what happens is during the course of a normal menstrual cycle, these lesions can bleed and they can cause extreme pain.
So why does endometriosis happen? Do we know anything about what causes it?
We don't know. There are different theories. One theory exists that perhaps tissue from the uterine lining may actually flow out through the fallopian tubes. Other people think that these lesions just spontaneously appear. There's some thought that, and there really seems to be data to suggest that there's a hereditary component, but in many women, there isn't a family history.
Mm-hmm. Are there certain risk factors that might make you more likely to have endometriosis?
Well, family history is a big one. And I think the interesting thing, and one of the tougher parts of being a woman, is women ascribe so many of their symptoms to just being a woman. Mm-hmm. Having painful periods, sometimes having pain during sex. These are symptoms that can be due to endometriosis. Women sometimes missing school, missing work because they have painful periods, and they're told to, be tough, kind of deal with it, when, yet they may have endometriosis.
Right. And I imagine if there's a genetic component, maybe if you see your mom having the same kind of experience with her period, maybe you just think, oh, this is normal.
Exactly. Yeah. And in generations past, perhaps women weren't diagnosed, women weren't really talking about it as freely. So as a result, it was sort of shoved under the carpet. People didn't talk about it. And now, the hope is that we can bring this discussion to the forefront so that women are more aware of it, that they can address their healthcare providers and maybe receive appropriate treatment.
So what you mentioned, pain and painful sex. What are some other symptoms of endometriosis?
So the symptoms really can vary from one woman to the other, and the symptoms really depend on where the endometriosis is located. Typically endometriosis is in the pelvis. It can occur on the ovary, most common site, fallopian tubes, on the uterus, the bladder, sometimes the bowel. Also can be found in other sites really throughout the body. And then the symptoms would be particularly the most severe during one's period because these implants change. And with the change and drop in hormones during one's cycle, they bleed. So again, extremely painful periods, heavy periods. Some women experience bleeding in between periods, and also some women do have pain during sex.
Mm-hmm. Can you have pain that's not related to your menstrual cycle?
Absolutely. Mid-cycle pain. Hormones are always changing during the course of a woman's reproductive cycle and reproductive life for that matter. So for sure. And I think that it's important for women to realize, gee, if I'm having symptoms and I can't really figure out what they are, address them with their healthcare provider, because endometriosis may be amongst one of the things one is to consider.
Right. So you mentioned that it's often hard for women to get the correct diagnosis. Why is that?
Because so many of the symptoms have to go along with being a woman. Women sometimes, have a difficult time urinating. They have urinary tract infections. Sometimes sex isn't ideal. I always joke that sex is perfect in the movies.
Right.
But, sometimes women have pain during sex. Sometimes women have a heavier period than not. And so they figure, okay, this is just me. This is what it's like, and maybe my mom had it. People have told me just deal with it, get back to work, don't miss school, you're being a wimp, and so it's not addressed.
Mm-hmm. Is it also so a big part of it is women just not even recognizing that it's a problem.
Exactly.
And not bringing it up to their healthcare provider at all?
Exactly.
Can there also be cases where the provider might overlook the symptoms, or perhaps there's a misdiagnosis?
I think without a doubt. I think particularly if a woman has symptoms not related to her cycle. One may figure, oh, she has a gastrointestinal issue, she's got a bladder issue, or the doctor may not be spending enough time with the patient. I think we're living in a time where it's not unusual for a woman to have just a very limited amount of time with her healthcare provider. And she may walk into her for an annual visit and have a little checklist to check off and have just a couple of minutes with her healthcare provider and not feel comfortable raising the discussion about things that have really been bothering her.
So if you're having trouble bringing this up with your provider, what's some language, what are some key things that women should be talking about and key things they should be saying in order to sort of get the attention of their provider?
Well, painful periods for sure. Periods that are so painful that, taking an over-the-counter non-steroidal, ibuprofen, something like that doesn't work. If someone has to miss work, if someone has to miss plans with their friends, miss school, miss family functions, if it's really interfering with the quality of your life, that really needs to be discussed. That's not normal. And pain that occurs throughout different times of the month, or a change in one's cycle, bleeding in between periods, or a period that's lasting for a long period of time, that should be discussed. And don't be embarrassed to talk about pain during sex. That can be one of the symptoms. And I think women are really embarrassed.
Mm-hmm. So how is endometriosis diagnosed then?
So it's a great question. So the gold standard is to diagnose it surgically, during the time of either what we call a laparoscopy or surgery in the abdomen or pelvis for other reasons. But a healthcare provider needs to be somewhat aware that the diagnosis may be present, or someone may have endometriosis if a woman presents with the symptoms that we just discussed.
Mm-hmm. So a laparoscopy, what does that involve exactly?
So a laparoscopic procedure, it's an outpatient procedure typically where a small scope is actually inserted. It's done under general anesthesia. It's done typically in an ambulatory surgery center or in the hospital. But it's general anesthesia, an incision is made in the level of the belly button, and a camera is actually inserted into the abdomen to visualize the contents of the abdomen and the pelvis.
Mm-hmm. And then, so the doctor is looking for lesions.
Right. Well, exactly. And the laparoscopy may be being performed for other reasons.
Mm-hmm. And then how do you treat endometriosis?
So if it's surgically, it can be either, cauterized, laser can be removed to remove these lesions. If there's scar tissue, the scar tissue can be, surgically disrupted.
Can that be done during the same procedure?
Absolutely.
The diagnostic?
Absolutely. And again, it really depends on the woman, and it really depends on how she presents. But I think that it's really important for women to know that there are medical ways in which they can be managed. And so if a woman has symptoms that are suggestive of endometriosis, she should talk to her healthcare provider, because it's great to avoid surgery when you can be treated medically.
Mm-hmm. So what are some of the medical options?
So medical options, they're varied. The sad thing is there really aren't any prescriptions available currently that are directly indicated for the sole purpose of treating endometriosis. However, that being said, traditionally we've put women on birth control pills, we've manipulated them hormonally, sometimes using the hormone progesterone. There are other medications that are out that target the centers of the brain, which then send down signals to suppress the production of ovarian hormones. Also, obviously, using over-the-counter pain meds, and then when pain is serious, using prescription pain medications.
Great. We're going to take a quick break. We'll be back in a second. So you were talking a little bit about some of the medications that you can take, and you mentioned birth control pill is one of them. So how does that help with endometriosis?
So it's a great question. So the pill works because it suppresses ovulation. So as we previously discussed, these lesions or implants that are a result of endometriosis undergo changes during the course of a normal menstrual cycle. And what happens when the uterine lining is sloughing and bleeding, so too are the implants that occur as a result of endometriosis. So by suppressing ovulation, which is what the birth control pill does, these implants and their growth frequently suppressed.
Right. So it levels everything out a little bit.
Exactly.
Mm-hmm. What about, are there any sort of at-home remedies that you can do?
So for treating the pain, some women just want to cuddle up with a hot water bottle, get into a warm bath, and that helps. I really am a firm believer in exercise. You know, exercise releases the body's own opiates and endorphins, and the body feels just great. So I think exercise, having, a healthy diet, and really, really will help a woman feel better.
So speaking of birth control, how does endometriosis affect a woman's fertility?
So it varies. Not just because someone has endometriosis does not mean she's going to have issues getting pregnant. And I think it's really important for a woman to know, so that in the event she's diagnosed with endometriosis, she shouldn't panic about her fertility. Obviously, if someone's having trouble getting pregnant and she thinks she may have symptoms related to endometriosis, she should address those symptoms with her healthcare provider, but not panic before the time arises.
Right. Are there specific ways in which endometriosis can interfere with getting pregnant?
Well, there are, and no one really knows actually to what extent endometriosis can play a role. Someone can have a minute amount and can have an issue. Some people can have a lot of endometriosis and get pregnant without having a problem. But the thought is, there may be tubal scarring near the ovaries don't move as freely, and it may impact, the ability for the tubes to pick up the eggs, but no one really knows.
Yeah. Have you seen that endometriosis affects women's relationships and their mental health?
It absolutely can, because when you really think about it, if the symptoms are so bad that a woman's missing school, potentially work, social plans, it can interfere with her interpersonal relationships. If she's having pain during sex, that also can be problematic. And when it's a recurrent sort of problem, it can lead to depression, insecurity, and self-doubt.
So it's really important to get diagnosed properly and get treated.
Absolutely, absolutely.
Yeah. So one last question for me is, what is your #1 piece of advice to any woman or girl who suspects that she might have endometriosis?
Well, I think the most important thing is to educate oneself about the symptoms, be aware, what these symptoms are like. It's not part of just being a woman, and raise the questions with your healthcare provider so that they can be appropriately, diagnosed and treated.
Well, speaking of which, we have a question from a viewer. What questions should I ask my doctor if I think I have some of the symptoms of endometriosis?
Well, I think it's important to ask the doctor where can they go for more information. And there are sites where they can go for more information. meandendo.com, great information. Patients should, again, come in with a list of their symptoms and say, hey, this is what is going on. Can you suggest something? Because this is really a concern of mine.
And so, in other words, should they keep a diary of their symptoms? Is that helpful?
Keeping a diary, tracking the severity of their symptoms, what their symptoms are. Is there a certain time during day in which they have these symptoms? Are there certain triggers? Is there a certain time during the course of their month they have their symptoms? All of these things would be really, really helpful, because when you realize a woman has such a short amount of time that she can spend with her healthcare provider, to come in fully armed and ready to have the discussion makes everything so much easier.
Right.
For the patient and for the doctor too.
Right, because the doctor's trying to fit it all in too.
Yeah.
Well, thank you so much for joining us today, Dr. Brightman. Is there anything you want to add about how can people learn more about endometriosis?
So women can learn much more information. They can also go through a checklist to determine whether or not perhaps they have the symptoms of endometriosis by visiting the website meandendo.com and joining the conversation at #meandendo.
Great. Thank you so much, and thank you everyone who has been watching. As always, you can get more great health information at health.com, and don't forget to like us on Facebook.